Hi, I'm Shirley Gutkowski. I'm a dental hygienist and I'm speaking to you today from my home office. I'd like to talk to you a little bit about x-rays today and whether you need them and not, and how they can affect your treatment outcomes. Mostly it'll affect your treatment outcomes because the doctor, the dentist, won't have enough information to make a proper diagnosis if there aren't appropriate x-rays. However, if you're one of those people who hasn't had a filling, who hasn't had any decay, who hasn't had anything worth watching in the last 18 or 24 months, it's very appropriate for you to ask to have the x-rays put off for another year or 6 months. I would encourage you to ask your provider why it is that they'd like to have the x-rays taken and what they expect to find in those x-rays. Most of the things that we think of in dentistry that we're looking for to prevent or to catch early are things that are pretty unusual, and the current recommendation from the ADA and the FDA, yes, both of them together, have made a recommendation that x-rays should be taken only with certain circumstances. So an examination should be done before the x-rays are done. And the x-rays should be taken if there's something worth looking at. For instance, if they saw that you had some bone loss last year when you had your x-rays taken, that would be an indication for maybe x-rays in a year from that time. If they had suspicions of a lesion on your teeth between your teeth and they didn't give you anything besides fluoride to help reverse that lesion, then yes, a year from now is a good time to take another x-ray. If none of those things are the case for you personally, then I would encourage you to ask for a reason why you need to have the x-rays and make sure that they document that reason into the record, and also to indicate in the record whether or not there were any findings so that they can track that. So that's it for today. If you'd like to have any more information, please contact me. I'm available all over the internet. My name is Shirley Gutkowski, Gutkowski, and I would be happy to be your patient advocate. Thanks for listening.